we've never done a webinar before, so I haven't seen this setup. So thank you for your patience. But I am Julie. I'm a doctor of physical therapy with Optimal Physical Therapy in Las Vegas. I am specializing in pelvic floor physical therapy, which is why you guys are all here tonight. And we're going to talk a little bit about pelvic floor physical therapy, kind of what it is, what the pelvic floor is, who needs it, who can benefit from it, all those kinds of good things. So we'll kind of start with an introduction. And for those of you who don't know me, I moved to Las Vegas in June and have helped Optimal get their pelvic floor program up and running. I was born and raised in Texas, went to undergrad at Cal State Northridge in Southern California, and then got my doctorate at the University of St. Mary. And how I got into physical therapy, I played volleyball growing up. I was always active, so I've kind of loved human movement from that. And my passion really grew for human movement in college. So I was a volleyball player, wasn't getting the playing time that I wanted. And so I turned to the weight room and my health because I felt that those were things that I could control. And while I was there, I played both indoor and beach volleyball. And 5 out of my 8 seasons there, I had the opportunity to be a team captain. And I really love the camaraderie of women's sports and being able to uplift women and help them recognize their potential. That's really what I loved about that, and felt that pelvic floor physical therapy and that experience, that was a perfect marriage of getting to uplift those around me and then combine that with my passion for human movement. I actually didn't even know that pelvic floor physical therapy was a thing until my second year of PT school, when I attended a student conference and heard about it for the first time, thought it sounded pretty cool, and then attended another conference my last year of PT school, and kept finding myself being drawn to the topics on pelvic floor, really because it was a really holistic approach in looking at the human body. So really kind of diving into nutrition, not looking at just the pelvic floor, but looking at the hips, the spine, all that good stuff. But we will get into that as we go on with this webinar. So just some talking points. We are going to go over what pelvic floor physical therapy even is, what the pelvic floor is, who needs it, the 2 types of pelvic floor dysfunction, and we will end the night with a Q&A session. And if you guys have any questions throughout this webinar, feel free to type them in the chat box, and I'll try to stop and answer questions kind of as we go. So we can go ahead and get started here with what pelvic floor physical therapy is. So it's a niche or a specialty of physical therapy for both women and men that focuses on the pelvis and the pelvic floor, the hips, the spine, the abdominals, groin, legs. So it's really more than just the pelvic floor, but all of those things kind of feed into the pelvic floor and how it works. And the pelvic floor is the layer of muscles that covers the bottom of the pelvic cavity. So if you think about the area of your body that's touching the seat of a bike when you're riding a bike. And then just to give you guys a visual, I have this handy pelvis model here. But these are the muscles inside and outside. There are 3 layers of muscles. And kind of going over the anatomy of that is outside of the scope of this webinar, but if you guys have any questions about it, feel free to ask. And so the pelvic floor really has 3 main functions. That is to support the pelvic organs, to aid in sexual function, and then to stop and start the flow of urine or gas. And beyond that, It also helps with core stabilization, assists the lymphatic system, and then can also stop, well, I mentioned that already, stop or start the passage of gas or stool. In order to locate these muscles, so the next time that you use the restroom, you can try to stop the flow of urine as you are going. And one of three things will happen. You will either completely stop the flow of urine, you may slow the stream of urine, or nothing will happen. And that will kind of give you an idea. If you're able to completely stop the flow of urine, you know that you've found the right muscles and the right way to activate the pelvic floor. Now, with the stop test, that's not something that you want to do every single time you go to the bathroom. That's not really a time to, practice contracting your pelvic floor muscles, but it is good to do kind of like once a month and then forget about it, just as a check-in to see how your strengthening is coming along, to see if you are, if you weren't able to stop the flow of urine before, if you're able to about a month later. The reason that we don't want to do that every time we go to the bathroom is because with that stopping of the flow of urine, if you do that every single time, it can irritate the bladder, and that is something that we want to avoid. And then next we'll get into the two types of pelvic floor dysfunction. So the two types are underactive and overactive. And pelvic floor dysfunction is really just an umbrella term for anything going on with the pelvic floor acting the way that it's not supposed to. So there are 5 general symptoms of pelvic floor dysfunction, and those are leaking urine or feces, especially with movement like running or lifting, frequently emptying the bowel or bladder, so if you're running to the bathroom all the time, pelvic pain that can radiate to the hips, low back, groin, thighs, or abdomen. So if you've been kind of dealing with that pain for a long time, have been seeking treatment for it, and nothing seems to work, it could be stemming from the pelvic floor if that hasn't been looked at. Difficulty emptying the bowel or bladder, so straining when you use the restroom, and then pain with sex or menstruation. So we'll kind of dig into overactive pelvic floor dysfunction first. The most common type of overactive pelvic floor dysfunction is pelvic pain. And there are a bunch of different diagnoses that kind of fall under this, but some of the most common are levator ani syndrome, which is pain near the muscles of the rectum, or pain of the muscles near the rectum, pudendal neuralgia, which is numbness or tingling, pain or discomfort of the pelvis or genitals. It's really common in cyclists or people with a chronic cough, so this is something that we're kind of looking at, especially with COVID-19, people who have been dealing with coughing for a long period of time. Pain in the urethra, groin, vulvar area, anal rectal region, sacroiliac joint, coccyx, scrotum, testicles, genitals. Also pain with penetration. So this can be from inserting a tampon, a medical examination, or sexual activity. And then sexual dysfunction can also be due to overactive pelvic floor muscles. Next, we'll kind of talk about underactive pelvic floor dysfunction. So the most common types of underactive pelvic floor dysfunction are stress urinary incontinence, pelvic organ prolapse, and fecal incontinence. And so stress urinary incontinence is the involuntary leakage of urine that's due to increased intra-abdominal pressure, which in more basic terms is basically the pressure inside of your body between your lungs and then your pelvic floor. And that intra-abdominal pressure can increase with the Valsalva maneuver or holding your breath when you're doing any kind of movement like jumping, coughing, sneezing, or laughing. And so if the pelvic floor muscles are weak, they can't withstand that increased pressure between the diaphragm and the pelvic floor, And so the pressure forces that urine out of the urethral sphincter, causing leaking. And so if we have strong pelvic floor muscles, the urethral sphincter will stay contracted and closed, which will keep urine from leaking. And then we also have pelvic organ prolapse, which is when one of the pelvic organs descends into the pelvic bowl or hammock, which is this right here. So it can descend into there and then press into the vaginal walls. And this is usually due to weak pelvic floor muscles. Sorry, I'm dropping my pelvis. Or ligamentous laxity. And that's one of the reasons why that happens after pregnancy so often, is because when people become pregnant, we get all these hormones releasing throughout the body. One of those hormones is called relaxin, and that causes the ligaments in the pelvic area and really all over the body to become more lax, allowing for the pelvis, the hips to expand to make room for a growing child. And some symptoms of pelvic organ prolapse can include pressure, heaviness in the pelvic region, or feeling like your organs are falling through the vagina. Back pain is also a common symptom. And then fecal incontinence is similar to stress incontinence, but rather than leaking urine, you're leaking fecal matter. So this is also due to weak pelvic floor muscles that can't withstand the increased intra-abdominal pressure with movement. And that pressure involuntarily forces fecal matter out through the rectum. And then depending on what your pelvic floor PT finds, so they're going to be looking in the first visit for either underactive or overactive pelvic floor muscles. And then based on that will determine your treatment plan. So with some people, I do find both. So they'll have really tight pelvic floor muscles. So just like you can get a knot like in your shoulder and your back, you can also get knots in the muscles of your pelvic floor. And so that is really kind of what I go after first if they present with both weak and tight pelvic floor muscles, because we want to address the pain first, and then also addressing mobility. So when those muscles are really, really tight, the pelvic floor is supposed to move along with the breath, move as you move. And if we can't get that movement, that really inhibits us from being able to strengthen the pelvic floor as well. It's kind of stuck, so we need to get it to move before we can strengthen. I like to say lengthen before strengthen. And then some common reasons to come to pelvic floor physical therapy. So if you are a new mom, I think every single new mom should come to pelvic floor physical therapy once they've been cleared by their OB to either return safely to exercise, to sex, dealing with C-section complications, managing a C-section scar, urinary incontinence, pelvic organ prolapse. The list just goes on and on and on. So postpartum, it doesn't end at the 6-week mark. That's kind of what a lot of doctors, OBs, who are wonderful, but they'll just say, all right, everything looks good at 6 weeks, and you may not feel ready, you may feel like something's off. That's where a pelvic floor PT can step in and help you kind of either ease your mind or get you ready to get back into physical activity with an individualized custom plan that works with you and for you. Another reason to come to pelvic floor physical therapy is if you involuntarily leak urine, so urinary incontinence. So commonly happens, like I said earlier, with coughing, laughing, lifting something heavy. And then there are other types of urinary incontinence besides stress incontinence. There's also urge incontinence. So This can be like if you're walking through the grocery store and then all of a sudden that urge to go to the bathroom hits you and you can't hold it any longer. Sometimes this involves leaking urine on the way to the restroom, sometimes it doesn't, but it can really become an issue like in social activities or social outings, which unfortunately aren't happening too much right now, but just making sure that there's always a restroom nearby, we can help you to make sure that that's not an issue for you down the road. And then another common thing with urge urinary incontinence, there are certain triggers. So sometimes it's every time you hear running water, you get the urge to go to the bathroom, or every time you get home from the grocery store, your arms are filled with bags of groceries and you just immediately need to go to the bathroom right when you step in the door. These are all things that can be managed through behavioral changes and then also are commonly found with weaker pelvic floor muscles. For men, if you had your prostate removed, that is a pretty invasive surgery, disrupting the pelvic floor muscles. So a lot of men experience urinary incontinence after that because the disruption has weakened those pelvic floor muscles. And then if you're experiencing fecal incontinence or constipation, so with the fecal incontinence, most of the time that's due to weaker pelvic floor muscles. Constipation can be due to overactive pelvic floor muscles. And we can kind of go over strategies to like not strain when you're using the restroom, or things like that, relaxing the pelvic floor muscles, teaching you massage techniques to really kind of get the bowel system moving. And then lastly, or not lastly, but if you're having pelvic pain, like I said earlier, commonly related to pelvic floor muscles. So this type of pain could be a dull ache, a sharp pain with certain movements, numbness and tingling, pain with sexual intercourse, or pain due to an underlying condition like endometriosis, PCOS, or interstitial cystitis. And your physical therapist is equipped to help you feel better, whether that's through manual therapy, the hands-on work, to release those tight muscles, or helping to mobilize the nerves to relieve the numbness and tingling. And then there are also tools that they can introduce you to if deemed appropriate. Also, if you're pregnant, that is another reason to come to pelvic floor physical therapy. So your physical therapist can provide you with patient education. Pregnancy-related pain is really common in the front of the pelvis, kind of in this area right here, is a really common area to be painful or just feel kind of off if you're pregnant. And then safely exercising during pregnancy, preparing for labor, and then prepping for postpartum recovery, and kind of giving you some things that you can do to help you along after you have a child and before you're cleared by your OB to resume activities. Next, we'll go over what to expect with a pelvic health or pelvic floor examination. So what to expect in the first visit. And what a lot of people don't know when they first come in and see me is that there is an internal examination along with pelvic floor PT. And one of the really, really great pelvic floor therapists kind of put a hot take out there not too long ago saying that if your pelvic floor physical therapist is not doing an internal examination, that they are not practicing pelvic floor physical therapy. That is what sets it apart from just orthopedic physical therapy. And there are certain situations where I will not do an internal examination, and that is if you're pregnant and I have not received written consent from your OB. And then if there's like active cancer or an active infection, then I will not perform an internal examination there. So when you come into your first visit, we're gonna talk about your symptoms, kind of get your baseline signs through a patient interview, an external examination, so what you kind of think of with just like any kind of orthopedic physical therapy, and then kind of getting and then the internal examination, getting all of that to progress throughout your plan of care. And this is different. The internal examination is different from a gynecological examination because we're assessing the pelvic floor muscles. We're not looking at the organs. It is really, really important to me that I provide you with the most comfortable experience possible. I really want you to feel at ease, and I'm going to put every effort forth that I can to make sure that we're communicating throughout the entire internal examination, and you are not going to be forced to do anything that you're not comfortable with. But keeping in mind that every provider practices a little bit differently, if you come to see me, this is kind of what you'll get when we're face-to-face. So you'll have some paperwork to fill out beforehand, and then once you come back into the evaluation room, we'll go over it together just to make sure that we're on the same page and make sure that you can tell me your story. I'm here to listen. I'm not going to be one of those healthcare providers that is just trying to rush you through. Like, I want to hear all of the information that you have that you think is related to your either pelvic floor dysfunction or whatever may be going on. And this just makes sure that we're on the same page and lets you tell me everything that won't fit onto a piece of paper. This also allows me to ask for any follow-up questions for clarification and then start forming the physical examination and treatment plan. So the external examination usually consists of a breathing, abdominal, and core stability assessment. And then I also check the hip and the low back range of motion and strength. So that allows us to check the areas of the body that support the pelvic floor or are closely related to the pelvic floor muscles. So your pelvic floor signs and symptoms may be stemming from issues in these regions, and then also vice versa if you have hip, low back, or abdominal pain. The internal exam is a pretty intimate part of the initial evaluation, and I can't stress enough how important it is for you to be comfortable. And while the internal examination really allows pelvic floor physical therapists to gain the best understanding of your condition and best treat your symptoms, you don't have to do anything that you're not comfortable with. But with that being said, the part of the exam is performed by your PT, inserting a finger into the vagina or the rectum so that he or she can coach you on how to properly perform a pelvic floor contraction and then also relax the pelvic floor muscles. And when I say pelvic floor contraction, that's also the same thing as a Kegel. So after assessing just the general strength of the pelvic floor, I also check the endurance, so how long you can hold a pelvic floor muscle contraction. And then I check to see how many times you can hold that longer hold before fatiguing. And then I'll check to see how many times you can perform a pelvic floor muscle contraction in 10 seconds, so the power of it. After that, then I will generally feel for any trigger points, tight spots, tender points, and then try to release those and check your response after. If you end up not seeing me, your healthcare provider should spend time with you explaining what they discovered in the exam, some tips that may help your signs and symptoms, and then exercises and behavior modifications if that's applicable. Most PTs love getting to spend time speaking with their patients and ensuring that they understand their signs and symptoms, as well as the plan to help you feel better. So you should leave knowing what to expect for next time, and not being confused by anything that you're doing, having a full explanation and reason, knowing the reason behind everything that you're doing. And then after an internal examination and then performing more pelvic floor muscle contractions than you may be used to, it's pretty normal to feel a little sore for a day or two after, but that sensation should be dull. If you feel anything sharp, you should let your healthcare provider know immediately. And that was a lot of information. So we're gonna open up the floor to anybody for questions if you have any. Don't be shy.
Can you hear me?
Yes.
Okay, should I type it or ask it?
You can ask it.
Okay.
That works better for you.
So, would this improve your sex life?
Yes, it can.
Okay. Shush. My husband is commenting in the background.
Yes, I have patients come in and they will tell me thank you from their husbands. So.
Okay. All my other questions I'm going to ask in person.
Okay. Well, I can't wait to meet you.
Oh. Why don't I see your face anymore? Uh-oh. Am I still on the microphone?
Yes.
Uh-oh.
Oh, you were muted, but then you came. Okay, never mind. It's gone. Would this be beneficial post-hysterectomy? Yes. So after a hysterectomy, you have your abdominal muscles and your pelvic floor muscles disrupted. So kind of like what I was saying with getting your prostate removed, it's kind of the same recovery as that. So after your muscles do need time to heal and recover, but after that point, they need to be strengthened again. And both the pelvic floor and your abdominal muscles are connected. You can't isolate them because they're connected by fascia or connective tissue. So we have to strengthen one with the other, and if one becomes weak, then the other one will likely become weak as well. Does that answer your question okay? Perfect. Do you know, where did it go? Do you know if pelvic floor PT during pregnancy helps prevent perineal tears during labor? So yes, perineal massage or perineal stretching is a form of manual therapy that I can perform, and that's basically just, I can actually show you with the pelvic model here. So coming in here with a finger and then pulling gently out until there's kind of like a light tingly sensation, and gradually working on that kind of week after week. I can also teach the patient how to perform that as well, but that just kind of helps you prepare for labor and helps that area to be able to expand for birth. What are some things we can do now to strengthen our pelvic floors? So pelvic floor muscle contractions are what help to strengthen the pelvic floor. You can also do any kind of core strengthening, but if you are having any kind of pelvic pain, I like to stay away from the strengthening at first, because if you're working on decreasing pain or relaxing the pelvic floor muscles, but you're also trying to strengthen it at the same time, it's kind of counterproductive. So we really want to focus on decreasing that pain first before we work on strengthening. And Kegels may not always be the answer. I know that with a lot of information that's easily accessible out there on the internet, it's like pelvic floor contractions, Kegels, just all the time, but those are not always going to be the right answer. So it's kind of my roundabout way of answering that. So one way that I like to kind of cue a pelvic floor muscle contraction, which my patients love this one. You can pretend like you're picking up a blueberry or a marble with your vagina. You can also imagine like a flower bud closing or an elevator door closing and then going up. So it's not necessarily a squeeze, but it's more of a squeeze and a lift. Let's see, I want to make sure I get all of these. Does having an episiotomy pretty much cause the most damage to the pelvic floor muscles? And about how long would you say therapy would be needed before having a next baby? So having an episiotomy does damage the pelvic floor muscles. It is a tear. So, and then having stitches after that also disrupts the area. One thing that pelvic floor PT can help with is teaching you a scar massage to keep that area mobile and keep you from having pelvic pain. And then about how long would you say you need therapy before having the next baby? That's going to be dependent on a case-by-case basis and communication between your physical therapist and your OB. Would this also help with lower back pain from L4 damage? Yes, it very well could, especially if, so what we see a lot in physical therapy is called the MRI effect. And this isn't to say that your pain's not real, because it definitely is, but it's not always linked to what we see in images. So somebody could have a really huge kind of bulging disc and not have any pain at all. And then somebody may have just the tiniest sign of damage and they are really going to be flared up. So it's really kind of about pinpointing where that pain is coming from, because it's not always coming from what is showing up on imaging. And glad I could answer your question, Cassidy. It's good to see you here. I hope you're doing well. Would you recommend physical therapy for someone that was diagnosed with pelvic girdle pain? Yes, absolutely. I have several patients right now. I'm assuming this is pregnancy-related pelvic girdle pain. Several patients right now who have it, and just giving strategies for like getting in and out of the car without pain, getting in and out of bed without pain, and then teaching some exercises that when you're kind of really flared up, that can help kind of manage your symptoms. And then also performing safe exercise throughout pregnancy that can really help that pelvic pain as well. Because with that relaxin hormone, we need those muscles to be strong and support the pelvis. And then this was asked privately. Does pelvic floor get worse as you start menopause? I was at the gym doing bear crawls and I peed without even feeling it. Is this pelvic floor? Yes, this is definitely pelvic floor dysfunction, and it can get worse with menopause. Doesn't always, but it definitely can, especially with the release of hormones. That definitely affects the muscles in that area, and then nerve sensation as well. So that can definitely be due to weak pelvic floor muscles. And then with age, just also it's kind of use it or lose it. So this isn't to say that you need to be just specifically isolating the pelvic floor, but if you maybe just started getting back into the gym, something like that, that could be the reason why you leaked urine. If you're kind of increasing that intra-abdominal pressure, like I was talking about earlier, after your body hasn't been used to that for a while, it may not be able to withstand that. Does anybody else have any questions? If I do this, will I be able to jump again? Yes, absolutely. And that's something that's kind of graded. So we really start based on where you're at. It can start as simple as doing table exercises, core re-strengthening, and then we gradually get into more dynamic movements like squats, lunges, and then single leg pelvic floor contractions, running, and then gradually building up to jumping. So it's an individualized, graded approach to get back to whatever you'd like to be doing. Thanks, Cassidy. All right, well, if that is it, then thank you all so much for being here. I hope you took something away from this. And if I haven't met you in person already, I look forward to meeting you. I believe we have this recorded, and I think we're gonna work on getting this up on either Optimal's website or my website. If you have any other questions, you can reach me at julie@optimalptlb.com. I'm also on Instagram at Julie Haake, JulieHaake DPT, and you can DM me. I'm happy to help answer questions, all that good stuff. So thank you guys for tuning in, and I hope to meet you soon if I haven't already. Bye.